Good evening and welcome to another edition of the COVID-19 Pandemic Update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. So it's been an intense, long-drawn and ongoing battle between the coronavirus pandemic and countries all over the world, and Nigeria is undoubtedly one of the battlegrounds. In the last 5 to 6 months, we've seen waves of lockdowns imposed in different regions of the world in order to contain the spread of COVID-19. While they lasted, the lockdowns largely fulfilled their purpose, but soon began to have direct and, in some cases, grave impact, especially the economy. For months, many sectors across the world like aviation, sports, tourism, among many others, were completely shut down. Thousands of jobs were lost, which gives rise to another round of serious conversation about how to find a delicate balance between shielding the people from infections and deaths, and on the other hand, shielding them from another kind of hunger and poverty. Well, Nigeria has, gone ahead to ease lockdown and open the economy. But when we look at the trajectory since the country began a phased and gradual easing of the lockdown, looking at the figures a week from 0 to April 27th, what we had over 1,337. To May the 4th, the number of fatalities that we had, 93. May the 11th, the number shows that reopening the economy, the figures have kept on increasing. May the 18th, you can see the figures there. May the 25th, up till June the 8th, where we have 31 cases. So we have had more cases of COVID-19 across the country. So obviously the virus is still here and it has impacted so many institutions, literally. They've seen no activity during the lockdown, and how Nigeria is executing its phased approach. Areas like the markets, the restaurants, offices, bars, flights, interstate travels, they were all impacted. With, of course, exceptions, the essential services, but even markets were generally closed at some points, and in some places, markets began staggered operations, also restaurants, which are now allowed to open partially, offering only takeout services. Offices, banks, businesses, they began slowly, but moving now to full swing. So all of these, with safety precautions, have been strongly advice, but it's also different for different states taking different measures to indeed get their economies up and running. But let's take you to what we're seeing in other countries. A few countries are also reopening their economies despite rising cases. Hong Kong, for example, Japan, Singapore, Germany, South Korea, China, Italy, France. Now, these countries have all seen spikes in the number of cases as they reopened, albeit cautiously. But it's also important to note that the increases that we're seeing were largely regional and ranged from slight to indeed moderate cases in terms of the number of cases that they had. It's also important to note that countries like Italy and France are beginning to see steady falls in number of infections. However, countries like Germany, South Korea, China, Iran, Lebanon, Saudi Arabia have had to reimpose partial lockdowns or essentially review the protocols. But yes, Nigeria is reopening its economy. The numbers appear to be definitely rising. But should we consider a second round of lockdown? And this is vis-a-vis the economic impact. I guess we'll leave you to answer that question. And of course, the authorities, as Channels Television continues to monitor the situation. Now, let's tell you what's happening elsewhere. State governors are asking the House of Representatives to review the proposed Control on Infectious Diseases bill to allow them handle future health emergencies in their states. They say the proposed bill robs the state governors of the power to declare health emergencies or make health regulations to curtail the further spread of diseases. The chairman of the Nigerian Governors Forum and Governor of Ekiti State, Dr. Kayode Fayemi, during the opening session of the public hearing today, says the bill confers overwhelming powers on the NCDC.
For us at the Nigerian Governors Forum, our position is that any disease with significant threat to public health that will require authorizing measures that may potentially infringe or otherwise reserve human liberties, The proposed measures must take into account a number of ethical considerations, balancing public health against human rights. The bill takes away the only authority the governors have to take specific steps and measures in their domains during an outbreak of an infectious disease. A situation where state governors do not have any power to make regulations in their states in the event of an outbreak of an infectious disease, or to declare any part of the state an infectious area, is not only inimical to the country's federalism, but also a recipe for disaster which cannot be managed by NCDC. This bill appears to vest overbearing discretionary powers on the Director General of the Nigerian Center for Disease Control. So for us, we believe that there are a number of provisions in the bill that must be reviewed.
And from the NCDC, 13,464 are the total confirmed COVID-19 cases in Nigeria after recording its highest infection in a single day, 663 cases yesterday, with 4,206 discharged and the death toll at 365. The new infections are recorded in 25 states and the FCT. Lagos has 170 cases from those number, while neighboring Ogun displaces other states to record the second highest figure at 108 cases. A breakdown by region shows that Lagos in the southwest has a total of 6,065 cases, followed by Kano in the northwest now with 1,020 cases. The FCT is next, topping the North Central with 1,012 cases, while Edo leads in the South-South with 462 cases. Borno retains its 367 cases, but comes up in the Northeast top, while Ebonyi leads in the Southeast with 152 cases. And now, the Rivers State government has reviewed the restriction on the number of worshippers during church services from 50 to 70 persons in the state. According to the state governor, modalities are also being worked out for the number of Muslims that will participate in Friday prayers. These were part of resolutions reached at a meeting of religious leaders at the Government House, Port Harcourt. Governor Nyesom Wike stated that his administration does not want to take decisions on reviewing existing restrictions on the modes of religious gatherings without their inputs. He noted that since the last meeting on the 23rd of March, when existing restrictions were collectively endorsed, the spiritual life of the people declined. The governor enjoined religious leaders to use their positions to enlighten members on the pandemic, especially those who doubt that it is real. Now, at the beginning of the virus outbreak, a National Emergency Operations Center, EOC, led by the NCDC in collaboration with relevant stakeholders and partners, were activated at the highest level, with states' ministries of health, task forces leading the response at subnational levels in areas of contact tracing, sample collection, risk communication, management of cases, as well as the treatment centers. Now, the NCDC also deployed national rapid response teams to support response activities in all 35 affected states and the FCT, with one aim, that major aim, to flatten the curve of COVID-19 in Nigeria. But how are states working to promptly detect, isolate, and manage these cases? The head of Health Emergency Preparedness and Response Department at the NCDC, Dr. John Oladejo, joins us on the program from our Abuja studios. Welcome to the program. I want to begin by asking, and this is following the phase 2 lockdown ease, how much understanding would you say Nigerians have? Do you think there's much compliance as a public health agency would desire?
Thank you very much. As a matter of fact, some Nigerians are actually complying, while some are not. You know, when you go around the city, you still see some people that are not wearing their face mask and not really observing the social distancing. So we're just using this opportunity that this is the most critical time. We need to observe all this and to comply according to the guidelines that was released by NCDC and the federal government.
Dr. Ladijo, we've been told that states need to own the COVID-19 fight. How are they doing?
As a matter of fact, we have actually, disseminated all the necessary guidelines to the states, and the states are actually trying their best. But we actually saw that we need enforcement, for the community, for the public to be able to, comply. The states, they are actually working hard to ensure that they expand the testing, because it's very, very important that we really test all the suspected cases, and then ensure that we're able to detect as many confirmed cases as possible. So they are actually working hard on contact tracing, as you have rightly said, and the communication aspect. We have all the communication messages on our website, which has been disseminated to all the state of the federation, and they have actually, use this one to do their posters and their IEC material. But the public, some of them are still having some doubt, so we need to let them know that the COVID-19 is real, and together we have to defeat this COVID-19. We have to fight against it. So we need the religious leaders, we need our traditional leaders, we need all the philanthropists to be able to work together with us and fight this pandemic.
Now, Doctor, we recorded our single highest infection in a day, 663. Do you think that we will get to a point where we could see up to 1,000 or over 1,000 cases in a single day?
Yes, when we first started, we were, having very few cases because we have not expanded, our molecular laboratories in all the state of the federation. But as I speak to you now, we have 31 functional molecular laboratory in all the 6 geopolitical zone, and they are all working with a maximum capacity. And this is actually responsible for the increase in number of cases we are having now, and we'll continue to have increase in the number of cases until when we get to a particular level when the epi curve we have to flatten out. So we actually, expanding the testing, because collection centers in the community. So this is the strategies that are being used at the state and the local government, and this is responsible for the increase in number of cases. But immediately we get these cases detected, then we quickly isolate the mild cases and send those confirmed cases to the treatment center, and then we continue to manage them. These are the strategies we are using, and at a particular point in time, it will now start going down. We really want to test as many as possible in the next few weeks coming, at least to a tune of about 2 million, so that we'll be able to know that, yes, we have actually tried our best and we are able to know all the cases, in the community, treat them, and ensure that we interrupt the virus in the community.
We appreciate your time. Wish you all the best as your agency fights the pandemic. Dr. John Oladijo, Head of Health Emergency Preparedness and Response Department at the NCDC. Thank you for joining us on the program.
Thank you.
Still to come on our COVID-19 updates, we take a look at the Control of Infectious Diseases Bill. We hear from the National Human Rights Commission. That's in a moment. And President Muhammadu Buhari presided over this week's virtual Federal Executive Council meeting at the Presidential Villa. The Vice President, Professor Yemi Osinbajo, the Secretary to the Government of the Federation, Mr. Boss Mustafa, the National Security Advisor, retired Major General Babagana Mongunu, the Chief of Staff to the President, Professor Ibrahim Gambari, and up to 10 ministers were physically present with the safety precautions observed, while the remaining ministers joined the meeting virtually. This is the 4th time the Federal Executive Council is meeting this way following the outbreak of the COVID-19 pandemic. The process has started to fine-tune the Control of Infectious Diseases Bill that seeks to repeal the Quarantine Act. The bill has since generated heated discussions as to the content. And we have the Executive Secretary of the Human Rights Commission, the National Human Rights Commission, that is, the NHRC, Mr. Tony Ojukwu. He joins us on the subject. Thank you. Welcome to the program. Now, you have said before now that this bill fails the Human Rights Impact Assessment Test, but the sponsors say it's a public health emergency. Is this bill a threat to public health?
Yes, because thank you very much for inviting me. For sustainability, any act in Parliament must meet the Human Rights Impact Assessment Test, because any law that will reduce the enjoyment of human rights should not be a law in a democratic society. Yes, it's agreed that in public health emergency, some rights may be abridged. These rights are known, but for you to now go ahead and abridge other rights, like encouraging use of force, which can result to torture, like arresting without warrant, even though warrant can be obtained, excluding, some vulnerable groups like people with disabilities and, orphans and also older persons, mentioning minors and extending the age of minors to 21 instead of 18, that is universally acceptable. And then also looking at this bill, what is the hurry about it? It is already the pandemic is being regulated already. So this bill, what is the hurry about it? We are still trying to understand the issues surrounding the pandemic. And it will be better informed if there is a total reform of the health sector that will take into consideration the lessons learned from the regulation of the COVID-19 pandemic. And then we'll have a comprehensive, don't forget that the Quarantine Act that is being used today was enacted in 1926. So this bill now is going to look at the future. So it is better to have a comprehensive bill that will look at all the facets of the issues involved, clear understanding of the pandemics and epidemics, and then we do a lasting legislation. You can imagine even the DG of NCDC said they were not consulted before this bill was proposed. So it is not human rights compliant. It is contrary to human rights and equity and good conscience, and therefore we cannot allow this bill to go on now. It has to be shut down.
But Mr. Ojukwu, one of the arguments of the sponsors are that existing legislation, that includes the Quarantine Act, is not sufficient to tackle what we are handling now following the COVID-19 pandemic. But it's been subjected to public hearing, the processes of, becoming law eventually. Don't you think that this process should continue? What do you think should happen next?
Of course, we have already started the public hearing today. We are continuing tomorrow. But at the end of this public hearing, we'll come to the conclusion that this bill cannot go any further. Because, like I said, the pandemic is already being regulated. There are regulations that have been made that the PTDF is using and the state governments are using to regulate the pandemic. So it's not as if there is any, let them point out to which area of the control of the pandemic that has not been regulated now, So there are some, if there are some gaps already, we need to do a better understanding so that we can provide a better legislation in future. This rush now is not very, very necessary, because before the process of passing this bill, signature to it, we would have gone too far into the management of the pandemic. So it is better to relax now and understand every issue and make provision. Look at things like compensation for taking over of property. Look at the palliatives. Look at issues that concern compulsory acquisition of property that should go to court. The bill is saying that the chairperson, the kind of powers that have been arrogated to the DG of NCDC cannot, is dictatorial in nature. And that will not help us. It will not be sustainable to pass a law like that in a democratic society at this stage, because it is bound to be abused, and then it will now be counterproductive. So it is better to look holistically at this bill so that human rights will be respected, so that all interests will be looked into, so that we can learn from our scientists what are the lessons learned from this handling of this pandemic, and we can make an enduring law that will stand the test of time.
We'd like to thank you. We'll see how far indeed it goes. The Executive Secretary of the Human Rights Commission, Mr. Tony Ojukwu, thank you for joining us on the program.
Thank you.
Uganda's President Yoweri Museveni has said the country is preparing a 40,000-bed field hospital at Nambule Stadium in the capital Kampala for coronavirus patients. The president said the Ministry of Health was initially planning 9,000-bed facility, but he had instructed that the capacity be increased. According to him, the country had managed to prevent coronavirus-related deaths, but warned that the numbers increased, that there could be more deaths. In the meantime, death toll in the United Kingdom continues to rise, and we understand that scientists have been looking at a genetics of the virus. The NCDC continues to work closely with states. You can find the latest national strategy to scale up access to COVID-19 disease testing in Nigeria and other public health advisory on the coronavirus disease. The website comes alive with all the information, statistics, with regular updates on COVID-19 regulations. Let's also take you to a live feed of the World Health Organization, its website. Each moment, there are regular updates about the spread of the pandemic. You can find the COVID-19 WHO global strategy as it guides the public health response. Also, our website, channelstv.com, is live with story updates from politics to Africa and news from around the world. Just log on, www.channelstv.com. Well, that's our COVID-19 updates here on Channels Television in collaboration with the Ford Foundation. Thank you for watching. I'm Millicent Walker. Stay safe.